Hello and welcome to EJC News Focus. Paediatric cancer is often seen as one of oncology's great success stories. In wealthy countries, survival rates have increased from 30% to 80% over the last half century. But experts warn that this trend won't continue. They say little further improvement can be expected from current treatments and that new research and regulatory frameworks are needed urgently. The Lancet Oncology has launched a series to highlight the unmet needs of children and young people with cancer and to challenge public policy. Richard Sullivan at King's College London co-edited the series, and I asked him first whether childhood cancer is really a neglected issue.
There's no doubt in high-income countries, childhood cancer has a strong political and social position. It isn't neglected in that sense in high-income countries. We've recognised it as being a major burden for a long time. It is the #1 cause of death in children in high-income countries. In lower middle-income countries, though, it definitely isn't a neglected burden. And that's something with this commission, by doing it globally, what we're trying to do is to highlight the major issues across the whole world. And when you look at it, the reality is that 80% of children are born now in low middle income countries. And so the burden for childhood cancers, without a doubt, falls heaviest in the countries that are least able to cope with this sort of burden. And by doing this commission, what we're doing is we're opening up the policymakers to realise that childhood cancer now is a global issue. It's a global community in terms of care, in terms of research and education and training. And we now need to see all children equally benefiting from the advances that we've made in high-income countries.
Why is the Lancet Oncology bringing out this commission now?
It was quite clear that what we needed to do was put together a policy focus in children with cancer, because we'd done a lot of work in adult cancers, and it was clear that most of the policy work around adult cancer had done very well, but children with cancer had kind of slipped off the agenda a bit, and this was a prime opportunity to bring together a whole range of experts. We've got nearly 34 experts covering 19 countries, the full range of the Human Development Index, from the highest income countries to some of the poorest in the world, to really look at what the major issues are in terms of their region and their experience. And so this is a prime opportunity now, with the development of new networks, development of twinning between high and low income countries, to really set some of the scene for the next 10 years.
There have been remarkable improvements in survival in childhood cancers. What barriers are there to this success continuing?
In high-income countries now, we're looking at a number of different issues. The first is an increasing understanding of the biology and being able to use the new tailored therapies, particularly against the sorts of cancers that we found very intractable to treat. But in lower middle-income countries, the issues are actually very, very different, and there's a whole bunch of reasons why we have problems. First of all, around affordability. Parents and families being able to afford their treatment in the first place. Secondly, about the availability of specialist centres, including the kind of chemotherapy drugs that are necessary. Illiteracy and poverty itself plays a very, very big role. Lack of human resources in the healthcare profession who've got expertise in treating childhood cancers, to name a whole raft of other issues. And all these things work against actually really good outcomes that need to be addressed.
What key changes in policy are you suggesting?
One of the biggest single issues we're dealing with at the moment in high-income countries is regulation, which is crushing childhood cancer research. The Clinical Trials Directive, data protection directives preventing registries for childhood cancer operating properly. These are major issues that need to be dealt with. If you look outside high-income countries, of course, the big issues there are the healthcare systems themselves, obviously. There's a need to develop affordable cancer care systems for children with cancer in those countries, and also an increase necessary for twinning activities. And by this, what we're meaning is actually putting together high and low income institutions to work together to develop policies from the ground up. Now, this is already ongoing. St Jude's, World Childhood Cancer, just to name two, are already engaged in these twinning exercises. And these are the sort of policies that the Commission has recommended. But it's very broad and it's very deep and it's very much contextually driven.
Is there the political will to make these changes?
but I think there's a broad recognition in the cancer community of what these issues are and potentially many of the solutions. And what we're really trying to do is to drive in the political motivation. So for instance, in high-income countries, the political motivation to change legislation at the European level, for instance in the Clinical Trials Directive, the political motivation to enable data protection legislation to allow research and childhood cancer registries to operate effectively. And this motivation moment, I would say, is lukewarm. And we're really hoping we're going to be using this commission to really driving home more motivation within political and the policy elites to change things, to make things basically more acceptable for childhood cancer research. If you're looking at low and middle income countries, there's no doubt some countries are really pick up the gauntlet. They're really driving forward the paediatric childhood cancer research agenda and also the quality of care. But in many countries, the advocates need help, need twinning, need support from outside to really drive home the agenda and really to help their policymakers understand that childhood cancers are important, that they can be used in terms of developing care and research systems as a way of improving childhood health overall. Focusing on cancer is not a question of focusing on cancer to the exclusion of all other diseases. Using these systems can help all children in terms of their health outcomes by raising the game in a country in terms of delivering childhood health overall.
You edit the online Journal of Cancer Policy, which is also planning a series of papers on paediatric oncology. What will that series cover?
We've decided with the Journal of Cancer Policy and our partners that we're going to develop a whole series of additional papers to back up the Lancet Oncology Commission over the next series. And this commission will essentially produce papers in economics, into social anthropology, and also to drive home some of the other messages from the commission in more detail. So it's a much more operational set of papers. We will look at, for example, essential medicines and palliative care for children. There's an awful lot of work that's been done out there, interesting enough, that hasn't actually been published, that would make a huge difference basically to policymakers and those engaged in either care, research or education and training. So one of the things we're hoping to do with Journal of Cancer Policy is provide the platform to get these pieces of work, learning, best practice, and also where things haven't worked, actually published and out there in the public domain. And we're going to do it, as I say, over the next 18 months to 2 years so that we really drive forward the messages from the Lancet Oncology Commission.
So on that challenging note, and with thanks to Richard Sullivan, that's it for this month's EJC News Focus.